Dr. Muff, 8 months ago you had a laparoscopic prostatectomy for chronic prostatitis. Before we get to that, please tell us a little bit about yourself.
My name is Dr. Nick Muff. I'm 64 years old. I'm a radiation oncologist. I treat cancer patients. I've been here in the Northwest for 34 years. I'm married to my lovely childhood sweetheart, Sue.
Can you tell us about your prostatitis? Which symptoms were most bothersome? How did it affect your life?
So my symptoms first began in fall of 1996. I was away replacing another doctor in Tennessee. All of a sudden, I just had to pee every hour, or maybe every half hour. And at night, I had trouble passing my urine. I didn't have any pain or fever or other symptoms at that point, and I just thought that was a little weird. But it progressed on through the year to where I was having the burning symptoms, finally flu-like symptoms, fever, chills, and then times when my temperature would go way down. Sometimes they say with overwhelming infection that can happen. I just felt horrible. At one of those times I told my wife, if I died right now, I wouldn't be surprised. I feel that horrible. And then I had to fly out and do a locums for another doctor in Arizona on January the 1st. And we were at the airport, and my daughter looked at me and she said, "You don't look right, Daddy." She's only 8 years old. I said, "What's wrong, honey?" She said, "You're gray instead of pink." That was a bad sign. And so on the way up, on the way down to the airport in the snow, I had to pee under the freeway underpass. Never done that. On the way from Phoenix up to my assignment, I had to get out and pee in the desert in the middle of the night and try to do my assignment the next day. And I was just so sick I couldn't do it. I never had anything like that happen. I always fulfill my assignments. They had to get a doctor to replace the doctor who was replacing the doctor. I had those symptoms terribly in 1996 and early 1997. They subsided somewhat then, but I have had them off and on for 13 years. And as to which symptoms are the worst, and that depends. During the acute episodes, I had this horrible pain where I sit down, radiated into my rectal area, aggravated by bowel movements, radiating down my leg. I had to pee every hour, wished I could pee every 10 minutes. At night, I'd be up every hour. The pain was so bad, I'd barely get back to sleep before I had to get up again to pee. And that was accompanied by flu-like symptoms, chills, fever, weakness, so that it made it really hard to do my job. And so this led to use of antibiotics frequently, almost constantly. And when the symptoms were at their worst, give me all the pain medicine you got. And fortunately, I have a good friend who's a physician who knew me well enough to give me fentanyl pain patches and oral pain medication. And with that, I was able to live. After those acute episodes, I wasn't on the pain patches again, but I was taking oral pain medication, Tylenol with codeine, off and on when it was bad. I had to try to get some relief from the discomfort. Obviously, it affected my life in every area. Working was an absolute nightmare. I mean, thankful that I have understanding staff, a nurse to help me get things done. There were days when I could just barely drag myself in here. That was horrible. Socializing. Who wants to go out when you have to pee every hour? Everywhere you go, you have to think about that. Where is the nearest restroom? And believe me, I know about everyone in this area.
Which treatments had you pursued? Did you get special treatment because you are a physician?
I didn't want to go to the Philippines to have my prostate massaged. I don't have the time or the money to do that anyway. So my wife tried that for a while. It was painful and inconvenient, but I couldn't see that it made any real difference. About a year before my surgery, we did run across on the internet prostate injections of antibiotics. That seemed to make sense. A doctor in Italy first developed that. We found someone here in the States who would do that. They inject the antibiotics directly into the prostate gland, which gives you concentrations in the gland 1,000 times higher than you can get taking pills by mouth. Puts the antibiotic where it needs to be instead of through your whole body. And nobody knows exactly yet what bacteria or if it's bacteria. So this had antibiotics to cover gram-negative, gram-positive, fungus, chlamydia. It had steroid and Toradol, which is kind of like injectable Motrin. And so I had a series of those injections, and they helped. You can watch on the screen a needle, you can see the medicine go in, so it's very accurately placed, and I got about a year out of that. Sometimes it took a long time to empty my bladder. I'd be sitting there, you know, running warm water, everything you can think of. So finally, to deal with that, I did have the TURP. And that did relieve those symptoms. At least, no matter how bad things got, I could still pee. So it wasn't a direct surgical treatment of the prostatitis, but it did get me relief from the obstructive symptoms. So as a number of doctors I saw, it's just hard to actually remember, 20 or more over the period of years. And I think 10 to 14 different locations, either hospitals or clinics that I was seen and evaluated for this. They had a psychiatrist see me. Surely he must have some hidden sexual issues or something. Why would a man want his prostate out? Unless he has cancer. That's the only valid reason they could see. And so the psychiatrist came and he talked a long time with myself. He talked with my wife. And then he came back, and just thank God for him, because he said, you know, I can see there's something really wrong with you, and I can see it's ruining your life, and I just pray that they find out what it is. And he had tears in the corners of his eyes when he said that. That's the best thing. Those tears were the best thing that ever happened to me. Somebody actually believed me.
What led you to laparoscopic surgery? Did you understand the risks associated with it?
It's not without its risks. I understand what those risks were. There's the obvious surgical ones. Yes, you can die of anesthesia or bleed or have all those things can happen during the immediate surgical period. And I deal with men who've had prostatectomy all the time.
How did your surgery go? It's been 8 months since your laparoscopic prostatectomy. How are you?
And the first time in 14 years, sitting now here, 8 months later, I am totally symptom-free. I don't have the perineal pain, I don't have the burning urgency, I don't have the frequency, I don't feel sick, I don't ache, I don't have chills, I don't have fever. That's a miracle. As far as I am concerned, there's just no other way to say it. Dr. Krongrad worked a miracle for me, something that I just didn't think could ever happen. So as far as use of medication, what medication? I'm not on any medication. I can't believe that. I haven't been off antibiotics for 8 months since 14 years ago. My wife has learned how to help with hand stimulation. What's not to like about that? And that produces an erection. It doesn't occur spontaneously, but that produces an erection. Fingers around the base of the penis hold that erection, able to achieve penetration and orgasm, and we have a restoration of our intimate life. I don't have to worry about the pain anymore. So when we feel like making love, we can make love. And it's actually, I think, more frequently now than before the surgery. That's kind of heaven, to go to bed at night and never get up. I don't have to get up to pee. That's the first time that's happened in so many years I can't remember. Gradually now, I am having some return of continence, as Dr. Krongrad predicted that I would. At night, almost. During the daytime, if I'm sitting, I can fill my bladder and walk to the restroom and empty it, generate a stream. But standing or walking, still have issues. I have men telling me at a year and 2 years later, they're still having improvement in that and their ability to get an erection, so I'm hopeful that way.
Is there anything more you would like to share with men dealing with chronic prostatitis?
So after 14 years of misery, I have my life back. I feel great. I look forward to the future. I'm energetic, and all of this happened because of what we found on the internet and because of finding Dr. Krongrad.